Good morning and welcome to the Ohio Commission on Minority Health's 2022 virtual statewide Minority Health Month kickoff and award ceremony. I'm Tracy Townsend from WBNS 10 TV. The theme this year is creating system change to achieve health equity. And yes, because of the continued challenges of the COVID-19 pandemic, we are virtual this year. The pandemic has highlighted the systemic drivers of health disparities experienced by racial and ethnic minorities in Ohio and across the nation. This has presented an opportunity to dismantle the institutional barriers to achieving health equity. April is Minority Health Month. This 30-day wellness campaign was created by the Commission in 1989 and then became a national celebration in 2001. This campaign was designed to provide crucial information to allow individuals to practice disease prevention, promote healthy lifestyles, and to highlight the resolution of disparate health conditions. During the month of April, there will be events across the state of Ohio. You can visit the Commission website at mih.ohio.gov. You'll find information about a virtual or safe in-person event near you. The theme for National Minority Health Month: Give your community a boost. The effort focuses on the continued importance of COVID-19 vaccination, including boosters, as one of the strongest tools we have to end the COVID-19 pandemic that has disproportionately affected communities of color. From the onset of this pandemic, the Ohio Commission on Minority Health partnered with the Governor's Office, the Ohio Department of Health, state agencies, stakeholders, and community members to inform state and local level efforts to ensure equitable access to testing sites, resources, protective supplies, and vaccines to vulnerable populations. And now a word of thanks to the corporate sponsors. It's through their generous support that we can host this virtual event, recognize our deserving award recipients, and yes, initiate Minority Health Month across Ohio. Each of these sponsors has demonstrated a commitment to improving the health outcomes of racial and ethnic populations in our state. We salute them today in appreciation of their partnership. Let's talk about the bronze level sponsors. CareSource. At the pewter level, Buckeye Health Plan, Humana, Molina Healthcare. Our copper level sponsors, Nationwide Children's, ProMedica. At this time, I would like to introduce Representative Amelia Strong Sykes, chairperson of the Ohio Commission on Minority Health. Representative Sykes was elected to House District 34 to represent her hometown of Akron back in 2014 and has served in Democratic leadership, holding the positions of Assistant Whip, Minority Whip, and Minority Leader. Representative Sykes has worked to improve public health, increase access to care, and combat Ohio's high infant mortality rate. Her passion for social justice extends to issues including freedom to vote, criminal justice reform, and rebuilding Ohio's social safety nets for struggling Ohioans. Please welcome Representative Sykes.
Good morning. My name is Amelia Sykes. I'm State Representative for Ohio's 34th House District, and I have the honor of serving as Chairwoman of the Board for the Ohio Commission on Minority Health. I would just like to say thank you and welcome to our Minority Health Month kickoff and 35th year anniversary. As you know, Ohio has the oldest Commission on Minority Health in the country. And in those 35 years, we have done great work to improve the lives of Ohioans in minority communities. I know you are in for a treat with our special guest and keynote speaker, our wonderful panels, and I am so excited for what we have in store with you. The work that we have done as a commission cannot be done alone, so I am so grateful and thankful for the award winners, to all of those who receive grants, and we look forward to the work that you will do. On behalf of the board, the commissioners on minority health, the staff, Director Angela Dawson, I say thank you and welcome. Happy Minority Health Month.
Now I present Bishop Timothy Joseph Clark, who serves as the senior pastor of the First Church of God in Columbus, Ohio, where under his visionary leadership, First Church has become a spiritual beacon at the local and national level. During his 40 years of service, he's also served in leadership positions at the local and national levels. Bishop Clark.
What a joy it is for me to be able to share with you today in this virtual gathering as we celebrate this 35th anniversary of the Ohio Commission on Minority Health. I'm going to ask you if you would, wherever you are, bow your heads and join me in the invocation and the asking of God to bless this occasion. Let's pray. Eternal God, how thankful and how grateful we are to you for all the bountiful blessings that you have so copiously, continually bestowed upon us. We look back over the landscape of our lives and our living, and we can truly say, as did the prophet, hitherto, up to now, God has helped us. We give you thanks and praise for this 35th anniversary of the Ohio Commission on Minority Health. We thank you for he who is in so many ways the father and founder of this marvelous commission. We thank you for she who now gives stellar leadership and who continues to blaze and chart the trail and the path for others to follow. We thank you for the difference this commission has made in real ways, in real lives, in real time. We thank you because our state is the better, our communities are the better, our people, their health, physical and mental, all are better because this commission exists. Though scattered, though virtual, we're connected by purpose, by call, and even by our passion to make Ohio a better place. So would you be the galvanizing force that brings us together, cementing us, making us one? We give you thanks and we give you praise in the name of him who makes all good things possible, even our Lord. And all the people said, amen.
Since 1987, the Commission on Minority Health has worked tirelessly to improve the health outcomes and eliminate health disparities in Ohio's racial and ethnic populations. In an effort to acknowledge the significance of their work are the following state leaders.
Hi, I'm State Senator Herschel Craig of the 15th Senate District. I'm so honored to have the privilege of presenting this resolution to the Ohio Commission on Minority Health on its 35th anniversary. On behalf of the members of the Senate of the 134th General Assembly of Ohio, we are pleased to extend special recognition to the Ohio Commission on Minority Health on the occasion of its 35th anniversary. This is an important milestone, and it provides an ideal time to acknowledge the exceptional work done by the Ohio Commission on Minority Health. Since its establishment, the agency has strived to eliminate health disparities in minorities' communities through such efforts as education, legislative action, public policy, and systems change. And its impressive contributions readily explain why it is so widely held in high esteem. All those associated with the Ohio Commission on Minority Health are to be commended for their foresight, dedication, and selfless dedication of time, energy, and the ability far beyond what was required or expected. These fine people have earned the respect and the admiration of many and have set an example of concern and responsible citizenship worthy of emulation. Thus, with great pleasure, we congratulate the Ohio Commission on Minority Health on its 35th anniversary and extend best wishes for continued success.
Hello, I'm Ohio House Minority Leader Allison Russo, serving Ohio's 24th House District. On behalf of the Ohio House Democratic Caucus, I would like to offer our heartfelt congratulations to the Ohio Commission on Minority Health on the memorable occasion of its 35th anniversary during your 2022 Virtual Minority Health Month kickoff and award ceremony. Since its establishment in 1987, the Commission has been a leader in the national minority health movement, demonstrating a strong commitment to addressing the health disparities between majority and minority populations. Your continued service to Ohio's minority communities and vulnerable populations is an inspiration to so many individuals and organizations. The Commission's work and accomplishments so far are a justifiable source of pride, and we are grateful to the insight, dedication, and hard work the Ohio Commission on Minority Health, its leadership, and staff demonstrate every day. We wish you continued success as we present you with this congratulatory commendation. Congratulations on your 35th anniversary, Ohio Commission on Minority Health. Here's to another 35.
So how did we get here? Makes me think about that old songwriter who said, I've been buked and I've been scorned. I've been talked about just as sure as you're born, but my soul looks back and I wonder how I got over. That is the issue. How did we get to this point? Who were the people who paved the way for me to advance this notion of establishing an Ohio Commission on Minority Health? First and foremost, Robert A. Fordham. Rob Fordham passed on October 13th of 2016. He served more than 30 years in the United States Department of Health and Human Services and was the original director of the User Liaison Program and was employed by the Milbank Memorial Fund. He invited me to Rensselaerville, New York, along with 20 of the other legislators who were considered our nation's leading healthcare experts, to discuss health promotion and disease prevention. I still don't know how I got in the room, but I was there. So when it came time to move our initiative forward, we had the solid support of Governor Richard F. Celeste. I had an in that I had served as his legislative intern and later his legislative aide. Also Archie Lewis, who was on the staff of the Governor Celeste, and Dr. Ron Fletcher then was appointed to co-chair this initiative with me. Dr. Fletcher was a well-known and highly respected oncologist from Dayton, Ohio. And I'm sure that Representative C.J. McClellan Jr. had his hand in there somehow because he always did. My mother, Inez Smith Miller, who unfortunately had to deal with all of these issues that I saw on the board, that I saw the scientists and the researchers talking about with respect to social determinants of healthcare, whether it was poverty, whether it was where you worked, the extent of all of your efforts that you had to put in to raising a family and still dealing with all health challenges herself, kidney disease, which she died from. So in countless people throughout the state of Ohio who, one, organized hearings and put forth solutions that became premier programs to address the health challenges facing people of color throughout our state. Staffing was key. Staffing is always the key. You want to find the very best and allow them to hire the individuals who can get the job done. And so we did that initially with Cheryl Boyce, who was our first executive director and did a tremendous job for many years. And then with Angela Dawson, she comes in, she puts in place her team, and we've been sailing ever since. So what were we guided by? We were guided by the disproportionate rates of infant mortality and alcoholism, heart disease, diabetes, homicide, chemical dependency, violence, and cancer. The disproportionate impact that those diseases were having on African Americans is the thing that opened everybody's eyes. As I close, I want you to know that it is time to meet the problem where it is. Chart your history. We need more boots on the ground. Very, very few people are going to bring you the problem and the solution on a silver platter. It doesn't work that way. Pay particular attention to the young people. Listen to what they are saying. Incorporate them into your plans. After all, they are the future.
Today, the Ohio Commission on Minority Health is continuing its public policy agenda by focusing on the upstream negative impacts on racial and ethnic health outcomes by advocating for health equities in all policies, requiring all health and human service professionals and agencies to receive cultural competency training and continuing education, expanding data collection efforts to include race, ethnicity, primary language, and country of origin to focus on trends, disease prevention, and health strategies to improve health equity, and expanding the nationally acclaimed Pathways Community Hub model to address the social determinants of health. The future policy agenda will include a focus on developing a racially, ethnically, and culturally diverse workforce and pipeline of clinicians and paraprofessionals to meet the needs of our changing communities. In addition, the Commission will be advocating for policies and funding to follow where the inequities exist, where there are unmet social determinants, and where the voices and perspectives of the negatively impacted are front and center in the public and private institutions, agencies, and boardrooms. The Ohio Commission on Minority Health will continue to learn, lead, and leverage its staff, community and faith-based and public and private health advocates to eliminate health inequities and meet the Healthy People 2030 benchmarks for all racial and ethnic communities. The vision is clear: healthcare quality and health outcome equity for all. Congratulations, former State Representative Ray Miller Jr., founder of the Commission, our amazing commissioners throughout the 35-year history, staff, and our Executive Director Emeritus, Cheryl Boyce, and our outstanding Executive Director, Angela Cornelius Dawson.
Congratulations to the Commission on receiving this high level of recognition. And at this time, we'd like to recognize all of our elected officials who are attending this virtual event today. Thank you so much for taking the time to celebrate the official kickoff of Minority Health Month and to honor the Health Award recipients. The Commission will be relying on your support in promoting their policy agenda. The past 2 years have certainly been challenging, and we commend the leadership of this state agency. At this time, we want to extend a level of gratitude for the board-level leadership of the Commission on Minority Health. For over 35 years, the Commission has been guided by committed leaders who embrace the mission of this agency. We thank each of the board members and designees of the Commission, both past and present, for your excellent leadership. The heart of great achievement. The Commission has an outstanding team of individuals who work daily to ensure that the Commission's mission is achieved. Thank you for your tireless efforts throughout the years and your willingness to achieve the goals of the Commission. The work of the Commission is realized through the implementation of grants awarded to organizations who are committed to the implementation of culturally appropriate models that are effective in achieving improved minority health outcomes. At this time, we would like to recognize our funded agencies of the Commission. These organizations and individuals strive every day, even during the pandemic, to safely serve our program participants across the state. You answered the call during these challenging pandemic times to ensure our participants were safely engaged. We are so grateful. Thank you to our demonstration programs, lupus programs, infant mortality certified pathways community hubs, Minority Health Month programs, local offices of minority health, statewide health coalitions, and local conversation initiatives. Thank you for the work you do in improving the health status of our communities. And now, our keynote speaker, Dr. Kamara Phyllis Jones, a family physician, epidemiologist, and past president of the American Public Health Association. Her work focuses on naming, measuring, and addressing the impacts of racism on the health and well-being of our nation and the world. Dr. Jones is currently the 2021-2022 UCSF Presidential Chair at the University of California, San Francisco. She recently completed her role as a 2021 Presidential Visiting Fellow at the Yale School of Medicine and as the 2019-2020 Evelyn Green Davis Fellow at the Radcliffe Institute for Advanced Study at Harvard University. She taught 6 years as an assistant professor at the Harvard School of Public Health, served 14 years as a medical officer at the Centers for Disease Control and Prevention. She is currently an adjunct professor at the Rollins School of Public Health at Emory University and a senior fellow and adjunct associate professor at the Morehouse School of Medicine. I present to you Dr. Jones.
Thank you to the Ohio Commission on Minority Health for inviting me to share for a few minutes some of my thinking on achieving health equity, naming racism, and moving to action. So what is health equity? Well, I define health equity as assurance of the conditions for optimal health for all people. And that's actually a little bit different from how Healthy People 2030 defines health equity, where they start out that health equity is attainment of the highest level of health for all people. I actually helped write that definition. But what troubled me about that definition is that what happens if we hit that last Sunday? Are we done? And in my mind, it's very important for us to recognize the distinction between health equity as an outcome and health equity as a process. So I really understand that health equity is a process. Which process? Assurance, which is actually one of the 3 core functions of public health identified by the Institute of Medicine, along with assessment and policy development. And assurance of what? Assurance of the conditions for optimal health, the so-called social determinants of health, which include our health services, but also go way beyond that to the context of our lives. And for whom? For all people. That is what makes it equity. So how do we get there? Well, achieving health equity requires at least these 3 things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. How is health equity related to health disparities? Well, health disparities will be eliminated when health equity is achieved. That is, health disparities are the differences in outcomes that we so, assiduously document in all of our reports and tables and graphs. Health equity is all about the opportunity structures and the resources and risks that came before. If you wonder, is my work about achieving health equity? You need to at least be doing these 3 things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. And I'll actually be participating in our panel discussion later, where I can go into more detail about how do we operationalize those 3 principles. But here's the most important thing that I want to say at this time. In this country, racism is a huge barrier to our achieving health equity. Racism is foundational in our nation's history, and yet many people are in staunch denial of its continued existence and profoundly negative impacts on the health and well-being of the nation. And even when people do recognize that racism exists, sometimes they find it hard to say the word or don't understand how can they move to action. So the rest of my time with you today, I am actually going to focus on racism as a key barrier to our achieving health equity. And there are 4 key messages when we start talking about racism. The first is that, yes, racism exists. And I say that because I've come to recognize that racism denial is like a huge black hole in our national landscape, like the black holes in the universe, huge, massive, powerful, but invisible. So I'll say a little bit more about that later, but we must acknowledge and communicate to all that, yes, racism exists. The second of these 4 key messages is that racism is a system. The third is that racism saps the strength of the whole society. And the fourth is that, yes, we can act to dismantle racism. So I'm going to share with you this first story. Dual Reality, a Restaurant Saga, is particularly useful if you're trying to understand or communicate to others that racism exists. This story is based on something that happened to me in my own real life as a medical student. So come walk into my shoes and let me tell you what happened. As a first-year medical student, I was, diligent, of course, and very studious. So on this Saturday, like most Saturdays, I had to wake up early. I was studying. Some friends came over in the middle of the afternoon. Did they distract me from my studies? Oh, no, we all got to studying long and hard. So here we are, noses in the books, and it's getting late. And we're getting hungry. And I have no food in the apartment, which was so typical of me that my friends understood. They were like, okay, never mind, Kamara, but we are hungry. So let's go into town and find something to eat. So we did. So we go into town, we find a restaurant, we walk in, we sit down, the menus are presented, we order our food, the food is served, here we are eating. So maybe not the story about racism that people in my generation might have thought that I was going to tell if I was talking about racism in a restaurant, but hold on. As we sat there eating, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now you're wondering, okay, Dr. Jones, what did the sign say? Well, what did the sign say? The sign said, open. So now maybe I've confused some of you or lost you. You're like, well, how is a sign saying open a startling revelation about racism? So let me recap. Here I am sitting with my friends in a restaurant eating. I look up, I see a sign that says open, thinking no more about it. I would assume other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized that indeed now the restaurant was closed due to the hour, but firmly closed. And that other hungry people, just a few feet away from me, but on the other side of that sign, would not be able to come in, sit down, order their food and eat. And that's when I recognized that racism structures open, closed signs in our society. That racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on because it is difficult for any of us to recognize a system of inequity that privileges us. So for example, it is difficult for men to recognize male privilege and sexism. It's difficult for white Americans to recognize white privilege and racism. In fact, it's difficult for all Americans to recognize our American privilege in the global context. Now, those on the outside are very well aware that there's a two-sided sign going on because it proclaims closed to them that they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. It doesn't even compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is that if, but if you do, why, you could even talk to the restaurant owner who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door, let them come in? You'll make more money and oh, the conversations we could have. Or maybe what you'll do is pass some food through the window, but at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign that proclaims open to you. So when I have just 5 or 6 minutes to share with a group of people that yes, racism exists, it is structuring two-sided or multi-sided signs, it's creating a dual or multifaceted reality, this is the story that I share. And I hope that you'll remember this story and share it with your family members and your colleagues and your neighbors. More people who were born inside the restaurant are saying the word racism, actually putting together the phrases structural racism, systemic racism. This is very heartening. But here's my warning. Racism denial is so staunchly held by so many in our nation, and it's so seductive that even if we say the word racism, which is very important because you have to name a problem in order to get started on the solution. Even if we put something up on our institutional web pages, even if we put something on our Facebook page, we tweet something out, Instagram, whatever it is that you're doing, if we just name racism, we may in 6 months forget why we said that thing and fall back into what I describe as the sleepiness, the somnolence of racism denial. So we must go beyond naming racism to action. And of course, racism is not just a sign, it's the sign, it's the door, it's the lock. There's a whole system going on. We need to dismantle the lock, take the door off the hinges, because once we start acting, we will not forget why we are acting. So now I know I owe us all a definition of racism. And again, I only have a few minutes with you now, so I'm just going to very quickly go through this definition. I could talk into this slide for 8 minutes. But when I say the word racism, I'm clear that I'm talking about a system. So I'm not talking about an individual character flaw or personal moral failing or even a psychiatric illness, as some people have suggested, even though racism can show up in those ways. But I'm talking about a system of power. A system of what? A system of doing what? A system of actually doing two things: structuring opportunity and assigning value. And on what basis is the opportunity structured? And on what basis is the value assigned? Based on so-called race, based on the social interpretation of how one looks, which is what we call race in this race-conscious society. Again, I used to do an hour-long lecture on what is race. No time today. But this system of structuring opportunity and assigning value based on the social assignment of, like, without even people even asking you, how do you self-identify, or where were you born, where were your parents born, or may I have a little aliquot of your blood, I have a genetic hypothesis. This system of structuring opportunity and assigning value based on this so-called street race has impacts. The first impact, when we do understand, when people do recognize that racism exists, is that we understand it's unfairly disadvantaging some individuals and communities. But it shouldn't take any of us long to recognize that every unfair disadvantage has its reciprocal unfair advantage, so that racism is also unfairly advantaging other individuals and communities. But there's a third impact of racism that many of us miss, and that is that racism saps the strength of the whole society through the waste of human resources. So when we don't vigorously invest in the full, excellent public education of all of our children, because the blinders of racism have made some of our decision makers believe that there's no genius in the barrios, the ghettos, on the reservations. We can get along very well, thank you, without those kids. And then, of course, we should all know that there's genius in all of our communities. And if we were to only vigorously invest in that genius, we could be doing so much better as a nation or even as a world. And actually, of the three impacts of racism that I have described, that third impact, how racism saps the strength of the whole society, is the one that I think we need to lift up most urgently these days. We actually need more media stories about how racism saps the strength of the whole society. We need more conversations around our boardroom tables. We need more conversations around our dining room tables, because we need more people filled with a sense of urgency to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. So not only is this story about that racism is a system, it's also a story that says we have to address racism at the system's level if we want to set things right. So I asked a very important question in that story: how is racism operating here? Which is a legitimate question, because racism is not a cloud, a miasma that we can't get a handle on. It is a system with identifiable and addressable mechanisms, which are in our structures, policies, practices, norms, and values, which are actually the elements of decision-making. That is, structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not. And whenever you find yourself at a decision-making table or set one, what your first question should be is who is not here, who has an interest in this proceeding. And then your job is not just to represent their interest, although you might need to do that in the short term, but really your job is to create space to find them a way to the table. And if structures are the who, what, when, and where of decision-making, policies are the written how of decision-making, both practices and norms are the unwritten how of decision-making. Practice is how we do things today, right? And I can teach you how we do things today or model it. Norms, that how we've always done things and how I expect you to do things always and going forward. And values are the why. And if we want to identify levers for intervention, targets for action, we should take this question: how is racism operating here? And look at the who, what, when, where, how, and why of decision making. And I tell you, in 5, 10, 15 minutes, you can generate 5, 10, 15 possible early targets for action, levers for intervention around which we can organize. So this brings me to the observation that, like health equity being a process, anti-racism is a process. And actually, I want to share with you the 3 tasks that I rolled out when I was president of the American Public Health Association 6 years ago in 2016 as my national campaign against racism. The first task is we must name racism, because you have to name a problem in order to address it. But naming racism, as necessary as it is insufficient. Necessary, but insufficient. We must move to action, which means the second of the 3 tasks is to ask this question: how is racism operating here? And taking this question with us everywhere. How is racism operating here in my child's daycare, at my work, with regard to police killings of unarmed Black and brown men and women, with regard to the disproportionate impact of COVID-19 on communities of color and the like. And then once we have done that landscaping, then we need to organize and strategize to act. Because yes, we each can act in our own individual capacities with the tools at our disposal. And it is important for us to do that. That is part of our individual anti-racism journey. But we also need to recognize that collective action is even greater power. So we need to organize and strategize to act, because collective action will inform us, inspire us, propel us, protect us. And this process is sequential, yes, but it's also iterative. So we need to name racism, ask how is racism operating here, organize, strategize to act, rinse and repeat. And this is going to be an intergenerational effort. So what can we do today? Going back to that image from the dual reality, first, we need to actively look for evidence of two-sided signs. We cannot be reassured by looking over and saying, oh, it looks open to me. So we need to actively look and say, are there differences in whatever impacts we're looking at, right? Is there something differential going on here by race, by gender, by language, by immigration status, by zip code, by urban rural, by religion, by what all the different ways that we have divided ourselves in this nation, looking not only at outcomes, but also at opportunity structures. We need to also burst through our bubbles of experience. Now, each of us is in a bubble of experience that includes our work, our children, our communities, our religious institutions, or whatever it is we're doing. And some of our bubbles are quite large within soap bubble boundaries. Some are smaller with thicker plexiglass boundaries. Some of our bubbles have been tinted. Some of our bubbles are polarized. Some of our bubbles have been hardened by fear. But whatever kind of bubble we're in, most of us do not recognize that just across town, there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We need to create at individual as well as institutional levels, bubble bursting opportunities so that we can experience our common humanity in different settings and start building common cause. We need to be interested in the stories of others and then believe the stories of others without requiring cell phone video documentation or body cam footage. And then we need to join in the stories of others. And I'm so heartened that more and more of us are doing that these days. We need to develop a sensitivity to see the absence of who's not at the table, what's not on the agenda, what policies are not in place that are put in place could have, result in more social justice. And we need to reveal inaction, lack of action in the face of need, because that is how structural racism very often shows up these days. But all the power is not just held by those who are inside the restaurant. Those of us on the outside also need to know our power, to recognize that action is power, and especially that collective action is power, because as I've said, collective action will inform us, inspire us, propel us, and protect us. So I invite all within sound of my voice to join together to be actively anti-racism if we are to be about achieving health equity. Thank you so much.
The commission will send a token of appreciation to Dr. Jones for her outstanding leadership across the country in the effort to achieve health equity. At this time, we will honor our Heroes and Sheroes of Health Award recipients. These are the people who are at the grassroots level, who give their time, their talent, and resources to improve healthcare to minority populations. They all demonstrate personal and professional commitment to the community's health needs. At this time, we present a Shero Award to Dr. Jennifer Ross of Akron, Ohio. Dr. Ross serves as the Director of Diversity and Strategic Initiatives for the Akron Urban League. Dr. Ross has been an active member of the community, focusing her efforts with a lens on health equity. She has worked to increase the awareness to the significant impact of COVID-19 on the Black community. As an educational consultant, she works to improve school performance through leadership training. She initiated COVID-19 barbershop talks to obtain the input of the community on the impact of the pandemic on their lives. We present a Shero Award to Ms. Renee Mahaffey Harris of Cincinnati, Ohio. Ms. Mahaffey Harris serves as the director of the Center for Closing the Health Gap. The center is committed to changing health outcomes for the most marginalized populations. She implemented the We Must Save Us campaign and created the COVID-19 Community Resource website to serve as a trusted information source for Black and Brown communities to ensure access to needed resources, vaccinations, and quality health care. In this role, she hosted over 30+ virtual town halls since April of 2020. She also initiated the Do Right campaign, which empowers communities to improve nutrition, increase physical activity, encourages healthy lifestyles to reduce obesity and obesity-related diseases. Her optimism in improving the health of Black and Brown communities in the health disparities has not wavered. We present a Shero Award to Honey Bell Bay of Cleveland, Ohio. Ms. Bell Bay currently serves as the Director of Adolescent Services for the Cleveland Urban Minority Alcoholism and Drug Abuse Outreach Program. In this role, she provides alcohol and drug prevention programming to high-risk youth. She's Cuyahoga County's newly installed Poet Laureate, and as a poet, she developed the following initiatives to provide an avenue for youth to express their thoughts and feelings. Pint-sized poets for elementary students, Elegant Ladies of Poetic Thought for young women, and the Renowned Distinguished Gentlemen of Spoken Word for young men. During the pandemic, she distributed food, donations, masks, and PPE to her community where she serves hundreds of people each week. Where there is hurt, she pursues healing. We present a Shero Award to Helen Joanne Roots. Miss Roots is a retired outreach worker from the Legal Aid Society of Columbus, Ohio. 21 years ago, Miss Roots observed during an outdoor church nativity program that many of her neighbors did not have coats or warm clothing. This observation birthed the Miracle on Long Street, a community nonprofit that focused on community member well-being and provides meals, clothing, toiletries, and school supplies. Ms. Roots and her helpers pursued partnerships with community agencies and churches to expand access to health screening and education and social resources at the monthly meals to include COVID-19 vaccinations. Her service to others began at an early age, serving elders and reading to children. Every time she faces a challenge, she consults her village of helpers, creates a plan, and makes it happen. We present a Shero Award to Tara Fox Williams of Dayton. Ms. Williams serves as the Director of Health Promotion for Public Health Department of Dayton and Montgomery County. Tara leads programs that focus on chronic disease prevention, maternal infant vitality, and child health and food equity, and minority health equity initiatives. She's a registered nurse at the Veterans Administration Medical Center. She contributed to efforts that led to the enactment of health equity in all policies approach, the declaration of racism as a public health crisis, and the reallocation of COVID-19 vaccine doses to racial and ethnic groups. Her approach to community work involves an intentional focus on social determinants of health to address both upstream and downstream interventions. She leads by example and is passionate about her work. We present a Shiro Award to Ms. Erin Bishop of Youngstown. Ms. Bishop serves as the health commissioner for the Youngstown City Health District. Her leadership during the pandemic was stellar, as she always reminded her staff that we will get through this together. She went above the call of duty and was the epitome of an empathetic, hands-on leader with a tremendous compassion for helping the residents of Youngstown. Her ability to reach out to businesses, organizations, community-based agencies, and churches to ensure engagement during the pandemic has really been vital to being effective in the COVID-19 rollout. She doesn't just assign tasks, she rolls up her sleeves and joins the team to get the job done. The Minority Health Community Action Award is given to those who are focused on the betterment and health of their community through improved access to quality health care, the provision of culturally and linguistically appropriate services, tailored prevention, education, and improving healthcare systems. Tyrone Smith. Mr. Smith serves as the project director at the Native American Indian Center of Central Ohio. In this role, he works to preserve and restore balance in the lives of Native people through traditional, cultural, educational, and wellness drive initiatives. He's responsible for the implementation of federally funded projects that align with that mission. Most recently, he has implemented NACO Cuisine, a Native American street food trailer. This is a tool to educate the general public about Native American cultural foods and traditions, and has resulted in employment opportunities. He's also served as a training and technical assistance coordinator for Tribal Tech, providing intense individual support to grantees to ensure achievement of deliverables. He's certainly enthusiastic about implementing wellness initiatives and prevention-focused activities that are culturally grounded, that promote the highest good for individuals, families, and communities in Indian country. Sudarshan Purkural. Mr. Purkural serves as the executive director of the Bhutanese community of Central Ohio. This organization provides support for post-resettlement director services, as well as linkage to culturally appropriate social services to address behavioral health needs. He started the BRAVE program, which focuses on addressing the pandemic to decrease vaccine hesitancy. And he also works to bring greater racial and economic equity for the communities he serves, and issued a call to action to address deplorable housing conditions. He was appointed by Governor DeWine to the New American Advisory Committee, which informs the governor and state leaders about the needs of refugee and immigrant communities, as well as their positive impact on Ohio's economy, schools, and communities. Dr. Laura Espy Bell. Dr. Bell serves her community as an emergency medicine physician with Ohio Health. She is the founder of the Columbus Black Physicians Network. It's a social service organization created to promote networking, provide membership, and volunteerism. Her concern about the impact of COVID-19 within the African American community motivated her to write and produce a video to inform and encourage communities of color about how to stay safe from COVID-19 and the importance of getting the vaccine. This video was featured during the Commission's Minority Health Month Awards ceremony last year. Dr. Bell leads a diversity pipeline initiative called Made for Medicine with the Columbus Medical Association to increase interest in medicine among minority students. She strongly believes that a diverse medical staff plays a key role in addressing health disparities and improving health status. El Puente Educational Center. The center serves as a bridge and connection point for Latino students and family members to academic success, well-being, and increased integration into the Dayton community. enrichment of the economic and community vitality of the greater Dayton area through the attraction, full participation, and contributions of the Latino community. The center meets the needs of families and communities by offering services that help families. The families and students served vary widely in English literacy aptitude, as many of them are taught English at school, but primarily speak Spanish at home. The center places focuses on community development and enrichment of education, social and civic engagement. The Director's Award, this was established to recognize an individual who has assisted the Commission in making significant strides toward the accomplishment of its mission and strategic plan. This year's recipient is Dr. Manoj Sharma. Dr. Manoj Sharma is an academician who has consistently provided leadership in health-related research for more than 3 decades. He has a PhD in preventive medicine from The Ohio State University. He's a founding member of the Research Evaluation Enhancement Program, REAP for short. It was created to provide evaluation oversight to the Commission on Minority Health-funded programs. REAP convenes evaluation experts with the purpose of improving the evaluation of minority health-funded programs, promoting health disparity research, facilitation of community academic partnerships, and building capacity of community organizations that provide health services to diverse populations. He's also over 700 publications, including 325 peer-reviewed research articles and 11 books. For 15 plus years, Dr. Sharma has worked closely with the Ohio Commission on Minority Health to prepare presentations that really build national awareness about the important work of the OCMH. Congratulations.
Good morning. I am honored and humbled to receive the 2022 Directors Award by the Ohio Commission on Minority Health. I do not see it as a personal recognition, but that of my team, the Research and Evaluation Enhancement Program, REAP. The program was initiated in 2005 by the vision of late Dr. Betty Young of Wright State University and Cheryl Boyce, the then director of the commission. The team presently comprises Dr. Elizabeth Talbot, Fatima Perkins, Dr. Joanne Mawasha, Dr. Jennifer Subban, Elizabeth Cinciello, and myself, who continue to tirelessly pursue the agenda of reducing health disparities in Ohio. In the past, under the leadership of late Dr. Betty Young, we've had the support of Dr. Peter Leahy, Dr. Robert Fisher, Carla Clayson, Marjorie Baker, Fatima Perkins, and Dr. Lucinda Deason on this panel. Finally, I would be amiss if I did not acknowledge the contributions of the coordinators, evaluators, and their teams at local offices of minority health, demonstration projects, and infant mortality hub projects in Ohio. We hope to continue our efforts in years to come to reduce public health disparities in Ohio and ensuring equity for minorities. Thank you very much for this honor that I am happy to receive on behalf of my team.
The Minority Health Leadership Award. This award is given to someone who has obtained funding resources for minority health concerns, impacted minority health with a hands-on approach by volunteering and through committee service. This year's recipient, Deaf Services Center. Deaf Services Center has been unwavering in its advocacy for health equity and community deaf services, including support for behavioral and developmental service needs of the deaf and hard of hearing for over 20 years. The center provides a comprehensive level of services for over 40 counties in Ohio. DSC developed 3 separate interactive trainings. These trainings have also targeted issues of trauma-informed care and opioid misuse, opioid use disorder, health equity, social determinants of health, and addiction. DSC Incorporated is a model of consistency, working tirelessly year after year to address these discriminatory perspectives. Congratulations to the Deaf Services Center. The Cheryl Boyce Minority Health Knowledge Award. This award is given to the individual who is dedicated to making an impact on minority health through research, education, and policy change. Their work has been focused on elimination of health disparities. This year's recipient is Mr. Johnny Chip Allen. Mr. Allen currently serves as an epidemiologist for the Center for Disease Control and Prevention, where his current focus is on training in convergence analysis. It's a technique that helps identify where different types of health disparities, health inequities, and social determinants coexist at their worst levels in the same neighborhoods. Throughout his career, he has demonstrated a commitment to impacting the ongoing research on the elimination of health disparities and the achievement of health equity. He's worked tirelessly to impact the prioritization of the disaggregation of data and the oversampling of the racial and ethnic populations to ensure representation and interventions. Mr. Allen is a much sought after national and state level speaker in the area of data analytics and public health. As the former health equity director for the Ohio Department of Health, he was the designee for the Ohio Commission on Minority Health for over 15 years, providing his expertise in the development of the grants management system, medical expert panel, and was essential in the efforts to scale the hub model. Congratulations to Mr. Allen.
Director Dawson and the Board of the Commission on Minority Health, thank you so very much for giving me the honor to receive the Cheryl A. Boyce Knowledge Award. This award was named after a pioneer in public health and to many who consider her the mother of minority health. I am deeply honored to receive this award and will do my very best to live up to the expectations of this award and to advancing health equity. Thanks so much, and please take care.
The Ray Miller Crystal Stare Award. The Crystal Stare Award is to acknowledge a person who improves the health outcomes of minority populations, pursues goals and achieves them, overcomes any obstacle blocking the achievement of their goals. And this year's recipient is Dr. Cora Munoz. Dr. Cora Munoz is a professor emeritus and adjunct professor at Capital University. She's an author, academic scholar, and consultant, national and international speaker, Fulbright scholar, diversity trainer, health advocate, and a community worker. She is the president of the Ohio Asian American Health Coalition, member of the Asian American Pacific Islander Advisory Council, and has served as chairperson of the Health Committee. Dr. Cora Munoz has committed her career to improve the health outcomes of minority populations in Ohio. She spearheaded numerous efforts to raise awareness of the health disparities of racial and ethnic populations, specifically among the Asian American Pacific Islander populations. She's worked to impact policy change in the academic and governmental arena. As a professor, she's influenced the curriculum modifications to include cultural and linguistic courses to ensure the focus on improving nursing students' capacity to effectively serve patients with different cultures, values, and beliefs. Dr. Munoz has promoted innovative strategies to improve access to services. She served as the chair of the Asian Festival Corporation Board of Directors. For the Health Pavilion at the festival each year, Dr. Munoz plays a major role in obtaining hundreds of volunteer hours from physicians, nurses, and residents to provide this screening access to thousands of free health screenings and remove access barriers. Dr. Munoz has been a champion in addressing the stigmatization of Asian American Pacific Islanders in the wake of the COVID-19 pandemic. Dr. Munoz worked to raise the awareness of Asian hate crimes to public officials and worked to provide public webinars to raise the issues on that very dangerous trend. In addition, she's been an advocate in working with systems to prioritize the disaggregation of data, as well as oversampling of AAPI populations to ensure they are adequately represented in data analysis. She's given time and talent to the larger community as an advocate for health and wellness. She's a board member of various organizations to attest to her exceptional service to the community at large. She served on the board of the commission for over 15 years and as a vice chair. Congratulations, Dr. Munoz.
It is my humble honor to receive the Ray Miller Crystal Stair Award for 2022 from the Ohio Commission on Minority Health. I'm very grateful for this recognition, for the work that still needs to continue so that our communities of color reach the highest potential to achieve good health. I accept this prestigious award on behalf of numerous people who've been working so diligently and with purpose to promote minority health and achieve health equity for all. I've been appointed as a commissioner at the Ohio Commission on Minority Health and served for many years under many governors, and I consider this service as one of my highlights of my career as a healthcare professional. I strive to make a difference in my little way during my long tenure in this commission. Indeed, I have the honor and the privilege to work with our beloved Cheryl Boyce, the founding executive director of the Ohio Commission on Minority Health. I also had the honor and privilege to work with Senator Ray Miller, with whom I served as vice chair, and whose voice I can still recall when he recited the poem Crystal Stair, thus naming this award. And I've worked with Director Angela Dawson, whose leadership and tenacity, persistence, and passion has taken the commission to a new level of accomplishments. Miss Angie, when I grow up, I really would like to be like you. Awards and accolades may be given to a person, and I am truly grateful. But the work is in fact accomplished and done by numerous individuals together, collaboratively, and with synergy to achieve a common goal. I am proud to acknowledge that many individuals whose wings I draw energy to propel forward in eliminating health disparities in minority groups, especially in my Asian community. I share this award with Elizabeth Chung and Bontan Pomasati, who initially introduced me to the state agency and nominated me to serve as a commissioner. I acknowledge the wisdom of other community leaders, such as Dr. Young Chen Lu, Ms. Wanda Dillard, Manju Sankarapa, May Chen, Dr. Greg Lam, former commissioner, and Dr. Yi Fan Glevin, the first governor-appointed Asian member of this commission. I also acknowledge my many students at Capital University and Mount Carmel College of Nursing for inspiring me to continue my work on cultural competency. I value the opportunity to serve at the table on diversity and equity initiatives of the Ohio Department of Health, the Ohio Mental Health and Addiction Services, and the Franklin County Public Health. Like all other groups, our Asian community has been faced with unprecedented challenges, and particularly during this pandemic. The incidence of anti-Asian hate and violence continue to increase, and racism persists in many groups that we all know impacts our physical and mental health. The work has begun, but much still needs to be done. And the road is long and winding, but filled with challenges and opportunities to address issues of inequality in health. But I see a bright light in the horizon. And as the poem by Langston Hughes goes, Don't you fall now, for I'm still going. I'm still climbing. And life for me ain't been no crystal stair. I thank you all for this Ray Miller Crystal Stair Award, and I praise God who has given me my life to serve and make a difference in this world. A world where health disparities should no longer exist and that equity and social justice prevails. Thank you very much.
At this time, we honor the outgoing members of the Ohio Commission on Minority Health. This group of committed leaders who are experts in their own areas of service have given willingly of their time and expertise to support the mission and vision of the commission. Their efforts have impacted the elimination of health disparities in our state. Dr. Erica King Betts, 2021 Vice Chair. Dr. Varun Mahajan. Dr. Jennifer Savitsky. And now, let me welcome Ohio Commission on Minority Health Executive Director Angela Dawson, who has been an advocate for the elimination of health disparities and the achievement of health equity throughout her career, serving 20 years as the director of a community-based prevention and drug treatment agency targeting minorities. She became the first African American to serve as the director of the Ohio Department of Alcohol and Drug Addiction Services. Since 2011, she served as the director of the Ohio Commission on Minority Health. We welcome Director Dawson.
Good morning. We are so pleased that you could join us for our official kickoff for Minority Health Month, creating system change to achieve health equity. April is Minority Health Month, a statewide 30-day wellness campaign created by the Commission on Minority Health in 1989 that became a national celebration in 2001. The continued impact of COVID-19 has required the transition to a virtual event. We do miss the opportunity to greet you in person, allow you to meet our honorees, and learn about our grant-funded programs. It's hard to imagine that COVID-19 has gripped our attention for the past 2 years, as we have continued to watch its devastating impact in the loss of lives across Ohio and this nation, with the most vulnerable populations experiencing significant disparities in death. So many of us have experienced the difficult loss of a loved one during this time, and our hearts go out to all the families. COVID-19 revealed the grim truth of the persistent health disparities for racial and ethnic populations and exposed the systemic drivers of these inequities. Yet, the pandemic has presented both challenges and opportunities. It presented an opportunity as Ohio was second in the nation for declaring the number of resolutions declaring racism as a public health crisis. We were encouraged as health departments, city councils, health systems, businesses, universities, and elected officials made their declarations. But now, we must move from declaration to demonstrated change. It also presented a challenge on how to authentically engage and establish trust with historically disenfranchised community members who experienced the disparate impact of COVID-19. These community members and community-based organizations gathered at roundtables and provided input through task force on the impact of COVID-19 in their lives. Their input further highlighted the need to create system change to ensure equitable access to resources. The pandemic provided an opportunity to develop the first ever state equity plan. In 2020, Governor DeWine acknowledged that racism is a public health crisis and released a plan of action to advance equity. This was an opportunity to initiate the work of system change through health equity interagency work groups and be transparent in our public reporting of progress. This equity plan also presents a challenge for all state agencies to examine our internal systems, policies, and procedures and dismantle structural racism and systemic barriers to achieving health equity. Throughout the Commission's 35-year history, we have worked to achieve the goal of system change. We have partnered with state agencies, local health departments, community-based agencies, and healthcare systems to create opportunities to impact intentional policies, increase allocations to eliminate health disparities. The Commission focuses on the prevention of chronic diseases and conditions such as cancer, cardiovascular disease, diabetes, infant mortality, and others that account for more than 85% of excess deaths within the African American, Asian American, Pacific Islander, Latino, and Native American populations. Ohio is to be commended on the considerable progress in decreasing white infant mortality. Based on 2019 data, Ohio was able to reduce the deaths to 5.1 per 1,000 live births. This is just shy of the Healthy People 2030 goal of 5.0 and years ahead of the target date. However, when we examine African American infant mortality rates, they are nearly 3 times that of white infants. This creates an equity opportunity for Ohio to expand its increased investments with intentional strategies to target allocations to eliminate this unacceptable disparity. The Commission pursued and obtained additional funding to bring to scale the Community Pathways Hub model to impact poor birth outcomes. This model is a nationally certified, evidence-based, pay-for-performance model that identifies and mitigates risk factors. This model has demonstrated return on investment and has shown improvements in African American birth outcomes. When we look across the spectrum of chronic diseases, Ohio has multiple equity opportunities to eliminate disparities in those diseases that are cost drivers in avoidable hospital readmissions and emergency room care. The Commission will continue to partner because no one state agency, healthcare system, payer, university, or community can do this work alone. We all have a role to play to achieve health equity and address systemic change. The Commission will continue in our efforts to increase the awareness and broaden the leadership to address disparities, to work strategically to improve access to quality health care, to advocate for workforce diversity and cultural and linguistic competency, to work across systems to ensure the availability of disaggregated health data and ensure the equitable allocation of resources according to need. The National Minority Health Month theme is #GiveYourCommunityABoost. The Commission supports efforts to ensure that vulnerable populations have ready access to vaccinations and accurate data on COVID-19 and access to the needed resources. We pause now to thank the hundreds of thousands of individuals across Ohio who are still serving on the front lines, providing quality health care, essential services, access to vaccines, and education. We honor your commitment. I want to extend my gratitude to the many individuals who have contributed to today's program. First and foremost, we acknowledge those whose shoulders we stand upon. Former Senator Ray Miller, whose visionary leadership created the Commission on Minority Health, and whose historical insights today remind us that we must continue this journey toward health equity. Former Senator Charlita Tavares, whose policy insight reminds us of the critical role the Commission continues to play in making system change. our Executive Director Emeritus, Cheryl Boyce, for her legacy of leadership in Ohio and across the country. Thank you to Governor DeWine, Senator Craig, and Leader Russo, who provided proclamations recognizing Minority Health Month and our 35th year of serving Ohioans. Thank you to all the elected officials who joined us this morning. We value your partnership in our legislative efforts. To our honorees, you are so deserving of this recognition, and we are so grateful for your commitment and dedication to making a difference in the lives of those you serve. To Dr. Kamara Jones, thank you for your commitment to impact organizations across this country to address structural racism as a primary means of achieving health equity and for reminding us that health equity benefits all of us. To Bishop Clark, thank you for using your voice to remind us of the key role that faith leaders play in addressing issues that impact our communities. To Representative Amelia Sykes, our board chair, thank you for your steadfast leadership and commitment to health equity through your policy and legislative agenda. To all our current and outgoing commissioners and designees, thank you for sharing your time and expertise. It is sincerely appreciated. To our wonderful Mistress of Ceremonies, Miss Tracy Townsend of 10 TV News, we thank you for your support of this effort and for educating the community about health issues. To our sponsors, we express thanks to you for your financial support and your commitment to address health disparities and achieve health equity in your organizations. To our grantees, this work can't be achieved without your committed effort. You, who implement chronic disease prevention programs, educate, empower, and inform our communities, improve health outcomes, and provide evaluation oversight and a return on investment. During this pandemic, you were committed to ensure access to our program participants, and you did not waver in your commitment. It takes a committed staff to lift this statewide Minority Health Month initiative. I want to acknowledge Ms. Benita O'Bannon, our Senior Fiscal Analyst, Ms. Nikki Jenkins, Program Specialist, Mr. Davin Riley, our Executive Assistants. Thank you for your diligence and dedication to serving all Ohioans. During the month of April, there will be virtual and safe in-person events throughout the state focused on the promotion of healthy lifestyles. Visit our website to access our statewide calendar of events. Thank you for joining us for the first half of our program. Please stay tuned for our Health Equity Panel discussion. We want to wish you a happy Minority Health Month. And remember, good health begins with you.
Thank you so much for joining us for the first half of today's program as we initiated the 2022 Minority Health Month here in Ohio. We certainly hope you will be able to enjoy the Health Equity Panel, which will start in 5 minutes after we close out this portion of the program. The panel will feature our keynote speaker, Dr. Jones, state agency directors, Director Corcoran, and Director Chris, along with Ms. Rolling McGee of HPIO and Dr. Dina Chisholm of Nationwide Children's Hospital serving as the moderator. During the month of April, there will be virtual and safe events throughout the state focused on the promotion of healthy lifestyles. Don't forget to visit the website, mih.ohio.gov, to access the statewide calendar of events. And remember, good health begins with you. Bishop Clark now joins us with the benediction. Have a great day.
Well, beloved, it's time for us to end this virtual gathering, but aren't you glad, as am I, that the God we serve meets us virtually as well as physically, that no matter where we are, that God, in all of the fullness of who He is, has promised never to leave us. Let's pray. Thank you that even though it is not the way we have been accustomed and not even the way that we would have chosen, thank you for this gathering. Thank you for this celebration. 35 years, a quarter of a century plus 10. How faithful you have been. Thank you again for the great work of this commission. Thank you for its long reach, its deep impact, its lasting influence. We thank you for these who serve, who work in any way, at any level, any contribution that they have made, volunteers and staff and tiers of leadership. We thank you for all of them, and we ask that you would crown their heads with your blessing, your benediction. Thank you for these who have been honored today, who have in their own way made a mark that will not be easily erased. And now as we go about the remainder of our day and the activities and assignments that await us, would you help us to be motivated by your love, pushed by your power, and reminded of your presence. We thank you, we believe it, we receive it, and all the people said, amen.